It is the family's preference. Again, it does depend on where they live. If they're, say, 4 or 5 hours away, then it may be hard for them to travel to a center that does everything under one roof. The multidisciplinary centers are advantageous because everything is under one roof. But that does not mean families cannot get that quality of care elsewhere, but it just means they would have to do more of the hard work of identifying the right providers in the community. So even having their pediatrician be their go-to person. And a lot of pediatricians in our community are amazing at holding it together for the families. So to just make sure they're plugged into the right therapies and are able to manage the other problems that can be there in any child in any family, like sleep problems, for instance. It's present in about 25% of children, but you can have sleep problems in children with autism in about 2/3 of the children. So it's a common problem that pediatricians are used to seeing and managing. So it doesn't necessarily mean they cannot manage a child with autism. We do recommend multidisciplinary clinics for children who may have more complex challenges there. So if it's complex behavior, aggression, and things that may be harder to be addressed by just the community providers. For children with genetic or known genetic conditions. So say it's Fragile X. The nice thing about multidisciplinary clinics is they may even have specific Fragile X clinics, which tends to bring families and children together with providers who may have more experience managing these conditions, and to also be in centers that could have access to more clinical trials, whether it's a clinical trial to study the natural history, which helps for the future, as well as more treatment measures may be coming in.